Hi there, my name is Daric Mueller, PA. I'm from St. Clair Shores, Michigan, and I'm reporting here from ACR Convergence 2025. And I attended a great session today talking about the roles and integrating APPs into rheumatology practice, both in private practice as well as academic practice. So first, Dr. Randy Cohn out of UAB, he discussed how he has successfully integrated APPs such as nurse practitioners into his busy academic practice. So he discussed a couple different models of integrating NPs, both those working in tandem, almost in a fellow-like system with him, and then also discussing the role of NPs in more of an independent fashion, especially once they've gained more experience. And he highlighted a couple amazing improvements in their workflow at UAB, specifically looking at decreasing the wait time of new patient referrals, given that a lot of those new patient referrals may be for non-rheumatic reasons. And they were actually able to highlight integrating an NP into seeing new pediatric rheum patients reduce their wait time from 150 days to 15 days. So it's pretty impressive. And Dr. Cohn also highlighted that integrating APPs allowed him to expand his academic pursuits, where APPs could see more of those patients in clinic day to day. So in a follow-up session to that, Miss Stacy Johnson, an NP out of Montana in a private practice, she discussed her experiences of being a rheumatology NP for the past 5 years and how her relationship with her hiring physician ended up coming to fruition over the years, and gave us some pearls on how both a physician and an APP can come up with a great success plan for onboarding. So she discussed a few things. First, the key in a physician should prepare to hire an APP onto practice, and in that preparation should understand what the legislation and laws look like for NPs and PAs in your respective state. They also discussed in that preparation that understanding what the role the physician wants the APP to play in the practice, whether the ultimate goal is to expand care to seeing more new patients and expanding care in general. Is that time that the physician wants to dedicate to clinical research while the APP expands access to patients? So having an important understanding of what that role for the APP in concert with the physician is going to look like is very key. Also discussing a timeline of where that APP should be in their training at 0 to 3 months and 3 to 6 months and 6 months and beyond should be, with an emphasis more on didactics and shadowing in the first month or so, and then expanding into understanding diagnosis and treatment of core rheumatic disease, and then more complex case management as time goes on. And then they also understood there's also a discussion that having a close working relationship throughout the duration of the training period and even after the training period plays a role in retaining that APP and fostering that healthy relationship. So.